She helms up the digital healthcare unit of Metro Pacific Investments Corp, the mWell app, offering telemedicine, e-commerce, as well as health and wellness programs in what is the Philippines' first fully integrated health and wellness platform globally. Please welcome the EVP and Chief Finance, Risk Sustainability Officer of Metro Pacific Investments Corp and CEO of mWell, June Chaye Cabal-Revilla. Good to have you with us, Chaye. Thank you so much for joining us.
Hi, Cathy. So good to be here.
And so how's the take-up coming along
We
during the
relaunched in
pandemic?
October 2022. Yes. So now we have 2.8 million users. Quite good because we're just turning 2 years from the relaunch. And then we have about 2,700 doctors outside of the MPH group because we're prioritizing the doctors outside of our family first.
Right, you've mentioned metrics there. May we have a comparison with the first iteration of mWell and how differently it is relaunched from 2 years ago?
So now we have more men. In the first run, we had more women, but right now the statistics actually show that we have 55% women users and 45% men users. So our Filipino men actually care about their health and wellness din pala.
Din pala. Okay, so they were like the latecomers, coming from the pandemic. Why are you seeing that kind of a change in the social demographic profile? Because when I look at statistics, it's really the women on a big scale, like 79% women who actually engage themselves in mobile health apps abroad.
So here in the Philippines, because we are mostly daily wage earners, men do that for their families, no? So I think they really care about their health because if they're not healthy, they're not able to go outside, like the riders and mga toda, the jeepney drivers, etc. They won't be able to go out to work and bring home earnings to put food on the table. So I think that's why our Filipino men actually care about their health more now. It's actually good for both the mothers and the fathers to care about their health, diba? And what we want to do at mWell is to also seed the young to take care of their health and wellness, both physical and mind health. We don't say mental because mental here in the Philippines has a negative connotation, diba? So we want everybody, all Filipinos to take care about their physical health, to think about their wellness, preventive health more than curative health, and their mind health.
And there are metrics for this para talagang masiguro that we're doing well on the health part and also on the wellness part. So it's a health and wellness app. What kind of metrics are you putting yourself up against on a daily basis
So
to make sure that you're healthy and well?
Yes. So the great thing about mWell is we have integrated ourselves with mainstream gadgets. No? So if you have an iPhone, an Apple Watch, Samsung Watch, other health gadgets like Fitbit and Garmin, you can actually integrate it and pair it with our mWell app, mWellness Score, which is one of my favorites in our platform. And then inside the Wellness Score, you have the Mind Health Score. So if I may share.
So you're going to share your scores then.
So this is our mWell app. When you open it, it says, "Kamusta ka, Chaye? Kamusta ka, Cathy?" Dapat ang sagot,
Self-love
mWell.
month.
Yes, that's correct. And then here is my favorite, the mWellness Score. So it's good that my wellness score today is 80. I slept nicely last night. So there's this physical wellness score and then the mind health score. The physical mWellness Score is actually a score that takes a look at your overall physical fitness from your being sedentary, which is not good, your light activities, your exercise, your steps, your sleep. The Mind Health Score naman is a function of the user being able to answer the World Health Organization's metrics on mental health. And so we have that. But apart from the Mind Health Score, we also have our self-guided mind health tools, many things. So kids these days, they don't really want to talk to counselors, etc. Diba? They want to be able to have their own pace in respect of helping themselves in terms of mind health. So here we have all the self-guided tools.
And including the wearables, I'm seeing that there are a couple of them. You have
I
about
have
three rings,
three.
plus, of course, your wedding ring and your watch, the mWell
Yes.
watch. How do
ML watch.
those work along with the app?
So any as I mentioned earlier, any mainstream gadgets can be paired to our M Wellness score. So this is an Apple Watch. So here is our M Wellness watch, and then here are our three M Wellness color rings. So we have bronze, black, and silver.
So does that mean you're connected to at least 3 phones right
Yes,
now?
because I'm
And
also testing it. Diba? We want everything to be perfect. So how
so
does
at the rate at which you're testing everything on those wearables and the mWell app, how is it coming along then?
It's similar to the Apple Watch in terms of the metrics, in terms of your steps, etc. Because we're trying to benchmark. So here naman, we
So your
have
benchmark is the Apple
Apple, Samsung. So
Watch
it's not
and
just me
Samsung
testing
Watch.
the Samsung or other gadgets. The rest of the MWell team would have two watches, one that's mainstream and one that's ours. Yeah.
So presumably everybody and everyone who is in mWell is wearing 2 watches.
Yeah, but there's no rule against having two, right?
But how does it feel like? I mean, how has that changed your behavior in terms of seeking a healthy and a wellness lifestyle? You
So-
go to work each day and presumably in a seated, air-conditioned environment. And how do you run up against that and promote something that requires a lot of movement?
So now I'm more conscious because before I got involved in MWell, you know my work, finance sustainability. So I'm just in a desk sitting down 12, 16 hours working. And before I had a lower back pain. Talagang nag-describe ng lower back pain. Talking about, I'm only 28 by the way. So when I got involved with MWell and I already know the variables that will, manage or help you determine your score, whether it's good or bad, then I'm able to adjust. For example, now at MPIC, what I do is that I work standing up in my laptop 8-10 hours. I only get to sit down like here when we're talking or in meetings, but I really just stand up and, move around.
You're not
Because-
worried about varicose veins?
No, at night naman before I sleep, I put up my legs. So there's always, ways to compensate for certain issues or certain fears or factors, right? But the other thing that I'm also conscious about is the sleep. Not just the quantity of sleep, but the quality of sleep. That's a function of our mWell ring. So for example, I hope my so I was able to sleep well last night. First time in
Yes, 80
years,
is a high
7
score.
hours, my highest, because I normally just sleep 4 or 5 hours. And then the MWell rings tell us of the REM, light sleep, deep sleep. But the statistics also say that the deep sleep is a good factor for a quality of sleep because that's the time when the cells regenerate.
And the movement part, I mean, yes, standing gets you to at least burn the extra calories, but you require the heart rate to at least move up.
Yeah,
So what do you do then in an office scenario?
so we do Zumba for 30 minutes
You do?
at least. 30
with
minutes.
your employees
Yeah.
every day.
Lunchtime.
Hmm.
So we
So you
normally
don't
just
eat lunch.
we do Zumba while eating or sometimes while in meetings. So we do that lunchtime or after office hours, and we don't even change anymore. It's as is where is, and it's fun.
How's that changed all your wellness scores then? I mean, if and when you compare, I mean, has it become a competitive sort of a setup there na, mas mataas ako sa'yo today?
Yeah, because we also have this leadership board at mWell. So, like at the MPIC level, for example, we have a leadership board, even at MVP Olympics, di ba? So, it includes TV5, Signal, PLDT Smart, Meralco, Maynilad, everybody. And then we get ranked. So, the number 2 there is Babe Singson, the CEO of MPTC, consistently.
MAP Man of the Year.
Yeah,
And
congratulations.
consistently the most, the healthiest, in fact,
Number 2.
in the group.
At
number
his age,
2.
I love you, Secretary Babes.
But tell us about that mindset change. How do you get that mindset change from the top and into the ranks, the employee level, and maybe even, convince family members to do the same and take care of their health and their
No,
wellness.
one of our push really is to do preventive health and take care and really think about our health and wellness. Because if you're not healthy, no matter how rich you are or how intelligent you are, then you're constricted, right? And what we've learned also from the pandemic is that if you have a very strong immune system, then it sort of helps you fight viruses, bacteria, etc. And therefore, your longevity and your quality of life is enhanced. And that's what we want for the entire Philippines. And that's why at mWell, we want to really push for health and wellness access, and then the availability and accessibility. We want that for everybody, for anyone, anytime, anywhere.
Talking about that inclusivity and that social demographic profile, men and women, nearly equal, but what about the senior citizens? Because presumably they would be the social demographic that one would be of, of great concern. Sila yung mga hindi makapunta sa ospital and might need the mWell app more than those who can be mobile.
So out of our 2.8 million users, 16% comprise 60 and above. 48% for 21 years like us to 40. So we're in the 48% bracket. And then for 41 to 59, that's about 22%.
And has that changed since the pandemic? Because people were more in touch with, what was going on in their bodies and all that. Because as well, mWell is a product of the pandemic setup that we had. Everybody got locked down, and people needed to consult doctors, and they had to do it online.
So the youth like us actually increased in terms of the number of users, because earlier on we had more older users. But maybe now, the young ones are more conscious also.
Well, I'm amazed that actually it's the seniors na nauna pa, that they
Because
were
of the
more
pandemic
digitally enabled.
Diba? Oo,
Correct. And that also brings us to the one of the preconditions of having mobile health is really digital connectivity. You wanted mWell to be available, accessible, and
available, accessible, affordable.
Affordable. Getting to available might be of a concern when you talk about a developing country with far-flung areas that have yet to be connected. How much of a hindrance is this in the rollout or in the take-up of the mWell app?
You know naman, in our group and our family, di ba, nothing hinders us eh. So at mWell, we actually put up an mWell on the go. That's a clinic in a bag, where we've made this available to far-flung areas, IP communities, even the soldiers in their duty, in the call of duty, so they're in the mountains, etc. So we actually have partnered with the DICT to reach very far islands, Tawi-Tawi, Turtle Islands, Batanes, etc.
Have you been to any of them?
Yes.
What was the most memorable?
The IP communities, actually. We've met them, and even the little people, the community in Laguna, where we service them. Kasi, di ba, they're hindered into commuting because they're really little people. Getting into jeepneys was very difficult for them, etc. So that's how far we've reached in terms of making health and access available and accessible, no?
How did you make it acceptable to them? I mean, yun sa wearables pa lang, what was their reaction just to see those rings and the watches?
Well, the great thing about being digital now is that a lot of people, like Filipinos, use Facebook, social media, etc. I think in terms of digital adaptation, we're one of the first in the developing or emerging countries, no? So Filipinos are maybe used to, or really adaptive of digital solutions. In respect naman of wearables, what we've also done was to make our wearables really affordable. So like, for example, our mWell watch, this is 2,499, very affordable, versus mainstream Apple Watch, which is about 40,000, di ba? So that's really our thrust, to make all Filipinos able to afford our consultations and even our wearables.
And considering yun sa AI pa lang, no, and that's pretty interesting, how to actually customize the app to the wearer. And it's the algorithms, the AI, you've made a mention of the AI in the app. How does that work in nudging the user to be compliant? Kasi compliance, di ba, is the number one issue for public health. Having people stick to a regimen or maybe even engage in healthy behaviors.
That's really a personal commitment, eh? Because
With or
us,
without the app.
correct, us and the government can only do so much, right? The commitment of the person to make himself or herself healthy is the decision of the person. And that's why we're doing this health and wellness awareness campaign, because we want people to be aware of their health and what they can do to actually improve their health, because we don't want Filipinos to just care about their health when they're already sick. That's how we are in the past. But right now, given nga the pandemic and our wish or dream for longevity and better quality of life, we should actually embrace being healthy and being well.
Balikan na natin yung pandemic kasi ito nga yung parang gave the impetus to create the mWell app was because of the lockdowns that we experienced. What was it like in building it? The first iteration down to the second version that was relaunched 2 years ago.
That's right. So the first iteration of mWell was really just a teleconsultation platform. At that time, it was the requirement or the need of our doctors, diba? Because we're with the lockdowns, etc. And that also gave our doctors the ability to be able to service other patients other than their own network. So our doctors now, if they're in Manila, they're able to service patients in Visayas, Mindanao. Diba? Kasi before, in the legacy network of hospitals, they're only able to service patients within their geographic area or reach. Now, it's borderless. So our Filipino doctors now even can service OFWs, which we badly need, right? For our real heroes, our OFWs outside. So, and then now, given that we also want to push for preventive health and wellness, that's really how our platform morphed into what it is now.
So itong mga doctors na to, they're all MPIC hospital doctors, or are there those from outside the ecosystem?
The doctors that we have in our mWell platform now is outside of the MPH, kasi we also have another platform or solution specific to our MPH group naman, which mWell also designed and developed for MPH, digital front door, etc.
Would
So
that
we're
be
helping
the
each
mWell
other.
MD?
Yes.
That would be the enterprise side, because
That's
what
correct.
we're just talking about now is consumer side.
Yes, that's
Nagba-branch
correct.
out na ang mWell sa enterprise. But very interestingly, yung the influence that it has on behaviors, how it actually nudges a person to, let's say, maybe considering a diet, how do the algorithms work to tell the user, maybe you can put a little bit of nuts on the ice cream and then go for a long walk afterwards to burn everything that you've eaten. Does the app actually have that capability to nudge the customer or the user to think a little bit healthier?
So for our app,
Or a
there's
little less, eat not too bad, don't eat the bad stuff, kumbaga.
So our app actually gives notifications and not just for physical activity. So if you're sedentary or sitting down or lounging for a long time, it'll tell you to stand up and walk around a bit. But we do have some features in the app that also helps us in the overall health and wellness sphere. For example, fitness. So we have this fitness tile where, sorry, ang tagal niya. So there are programs. If you want to be lean and toned, there's a lot of fitness videos, self-help, etc. And then there are also there's also a tile on food and nutrition. So it gives us the recipes, healthy recipes, and it also tells us if you don't cook, the nearest restaurant near you to actually go to and eat or order from. And then there's many more. We have home care for those with seniors that need medical or like nurse or whatever care help in the house. There's home care also. There's many things actually.
So ang online consultation, talagang bumulusok yan yung during the pandemic. Sa ngayon, are there as much online consultations or are you finding that the services really are in what you just mentioned? Home care services, maybe even pharmacies?
Yeah, because our consultations also digitally, we have the capability of giving e-prescriptions, digital prescriptions, and the ability also for the user to just push buttons and then the medicines that you can order from our group can be delivered into your house. So it's really very seamless. And then speaking of wanting to be healthy, it's really having the access and the ability to be able to book doctors or dental clinics, etc., therapy. So we also have a health hub. So we're actually the Uber or the Grab for everything that's health and wellness, diba? So if you for dental clinics, for example, it tells you which is, if you're here in TV5 in the Mandaluyong area, it will tell you which ones are, you allow, which ones are, see, Mandaluyong. So you have a dental clinic that's nearest you, and you're able to book digitally. Because right now, it's like not naman the yellow pages, but you have to text or call, right? But this one, you can do digital scheduling or booking 24/7. And then the portal also we give to the clinics naman. This is us at mWell trying to enable also the SMEs involved in health and wellness. So it's not just our hospitals that we're taking care of, we're also digitalizing the smaller clinics that need the digital front door or the digitalization that they're not able to afford by themselves.
So how do you make money off that then? I mean, it's a free app. You can download it for free. How does mWell make money?
So here, every time that there is a user that uses a teleconsultation with doctors, for example, we charge $3.99, but that actually already includes all of the digital e-prescription, medical certifications, and a 20,000 value life insurance. And which is being also given digitally, can be given or passed on digitally to others. And then how we make money is just the booking fee, the use of the platform, which is 100 pesos, which is much cheaper than, hailing a cab or something or paying for gas going to the clinics, and you will have to wait pa, di ba? Yeah.
So that's you're generating revenues right now, and
Yes.
we're not even talking about the in-app purchases.
Not yet.
Not yet. But is that coming through any?
Very, very, very good
Anytime
actually.
now?
Yes.
How?
No, it's actually in the e-shop already.
It's in the e-shop. Could you tell us more about how that works? Because may e-commerce na rin kayong parang component within the app.
So in our e-shop, you can actually purchase all of our products and services. So for example, our health passes, we have that available digitally or by card. Kasi, for example, if it's Mother's Day or birthday, diba, there's no Hallmark cards anymore now. So we made that digital, pwede siyang given digitally, and then the card talaga that you can give with a ribbon, etc., and dedication. And then you can also purchase the on-the-go, the clinic in a bag, for LGUs, or if you want to just give like a clinic or an barangay hall, something like that, you can buy or if you own an island of your own, you can buy your own on-the-go so that you have a clinic in a bag wherever you are. And then our wearables, the most popular that we actually have that's being sold at our e-shop are our wearables, the watches and the rings.
Balikan na lang natin yung enterprise side because this involves the doctors. What's the take-up like when it comes to the doctors? Because there are those doctors who probably won't feel or don't feel as comfortable having to go through an app thinking that they are still in the best position to take care of the patient.
Well, they're actually taking care of their patients naman digitally. Kasi,
And are they comfortable with that? Or may na-encounter ka pa rin na parang resistant?
no, I think the younger ones actually appreciate the digital platform even more because we're not a substitute for critical care, ha? So, for non-critical consultations or even after, for example, an operation, etc., if you want to consult with your doctors and just say, this is how I feel, etc., you can consult with them digitally. It sort of takes out the stress in, traversing the traffic, etc. And also, the good thing about the platform is that you're able to schedule with the doctor on time. So when you go to the clinics, for example, you don't have to wait an hour or 2 hours because it's seamless already. And then the other thing is also, it gives or it expands the doctor's reach for their patients. Like most doctors now, if you see them face to face, that's it. But right now with the digital platform, if they're in a car or even if they're vacationing abroad, with the mWell app, they can still service their patients. And we also have the corollary personal health records of their patients in the platform, which they can access 24/7.
Sabi mo nga, the app is not a substitute for critical care. But what about clinical care and what the patients do with the information they get from the app, data-driven as it is? Ano ba yung ginagamit nila or ano yung ginagawa nila doon sa information that they get from the app? Do they act on it? Do they see a doctor because of what comes up on the app?
Well, I think individually they can take a look at their scores, right, and change their lifestyle if it's necessary. But for certain patients, then they're able to share the results of the medical records to their doctors. Siyempre, with data privacy and cybersecurity, that's a given because of our group, no? They're able to share. And like when from a personal experience or user experience perspective, you don't have to write, my name is Cathy Yang, I'm like this, and you can already share in the clinics and the doctors your personal health records. And you have it with you, diba? So wherever you go, if you say go to Singapore or the US, you have your health records.
But then it's digitized nga, and that's the interface that the doctor has. And you did make a mention of cybersecurity. How can we remove that fear? Na, there's also emotional data involved in the exchange of real-time information with the doctor. How can we assure the users na hindi siya mahahack?
So the platform was already designed from the onset, day zero, with cybersecurity already, with a design team, and we are part of the PLDT MVP group, right? And that's one of our strengths. So that should give comfort to our doctors and to our patients and users.
Inaisip kasi natin yung Vastamo, yung Finnish psychotherapy firm during the pandemic, na-hack siya. And it was that emotional data that the patients really worried about. So how can we remove that? The possibility, kumbaga. There is the possibility it can happen.
Each user and each doctor is actually an entry point. So for example, if the users or the doctors click mga phishing links, they're the ones who actually give out their information. But what we've done at mWell was to design the platform in Lego blocks, in chunks, so that if there are, God forbid, any hackers, they're just limited to certain areas and not all. And we've also encrypted our data. So even us, we won't be able to see your score. I mean, it's all encrypted. It's just really you.
Yun sa hospital records, isang malaking problema yan, ano? I mean, if there's anything that the app can do and digitalization can do is really get that in order for the doctor. So, pabor sa kanya. So that when he or she sees the patient, nandoon na, yung records, pull out na lang. But what are you doing from the mWell side to ensure that the computer systems are talking? Because you made a mention of the hospital ecosystem that you're having to deal with. They're all legacy hospitals. Paano ngayon i-align, kumbaga, no, ang mWell doon sa mga hospital records, the management of hospital beds, and all that?
So that's work in progress for us at the Metro Pacific Health Group. At mWell, we have many solutions, enterprise solutions, apart from our user app and consumer app. No? So we have mWell MD for the doctors. We have mWell PE, which is for the patient engagement. We have mWell CMS, the clinical medical system for clinics and the maps in the hospitals, and HIS also, which is the hospital information system. So it's at mWell, it's very easy to integrate because we're on the same page, right? We try to address the pain points of our patients and the doctors, because it's very, very important for us to be able to optimize their productivity. The doctors, the employees, the staff, etc.
Mahirap ba? Ano yung mga pain points?
Siyempre, kasi pagod na nga sila tapos magsusulat-sulat pa. So the least thing we can do is to really enhance the customer experience of the patients, the employee experience, and doctor experience of the ones who are behind our great Metro Pacific Health Group.
But at the same time, the health group, as I understand, is also creating its own integrated digital point so that it can connect, kumbaga, no, with what you're doing from mWell. How's that coming along, creating that infrastructure so that it's seamless in the back end?
So the digital front door of MPH now has been developed by mWell. So there's really a close collaboration. We're helping them in areas that they need help on. Right now, the booking and the scheduling, they don't have that. Even the EMR, we also developed that for them.
So that would be favorable to doctors. Also patients, kasi magkakaroon sila ng parang real-time information exchange.
That's correct.
And make it really seamless, and that's the ideal. Is there any pushback from the patients on the patient side? Is there a social demographic sort of siguro group na medyo resistant pa?
None naman. I think because when the patients and the users experience something that's seamless and nice, they embrace it right away. So our challenge right now is to be able to implement faster and make the customer and user experience more awesome.
What's keeping you from going any faster?
Just the alignment, I think, from the MPH group perspective, because we grew by acquisition, right? So it's like one hospital here, one hospital. That is really the standardization of the processes, which we are doing right now with MPH.
And are you looking to ally with other hospital groups outside the MPIC
Yes,
ecosystem?
we are. Yes, we are also.
What sort of timeline are you looking at? And would it be the same kind of engagement for both consumer and enterprise?
Yeah, so we're also trying to address the needs of smaller hospitals, obviously, because we want to help them also. Because the ability for the smaller hospitals to be able to refer to our bigger hospitals, because there are certain services that are not available in their hospitals right now, is also an opportunity for MPH.
Again, we're talking about cancer, maybe specialist clinics, no? Kasi nandoon din there are about 10 specialist centers already. Those you want to also involve down the line and also outside it. Is that right?
So we are also in the process of creating a cancer care management solution, which is going to complement the cancer care clinics that we have. So same logic where the cancer patients would go to the clinics for critical care, etc. But the other care naman after procedure will be taken care of by mWell in the platform. So we're also in the process of developing this. Actually, we did the discovery in Singapore. We had many, it's a collaboration among big names. No? Apart from mWell, we had Microsoft, SAP, TELUS Health of Canada, Activo. Yeah, and we also got some research and very, very key studies from pharmas.
And they're of interest. They're very interested
because
as well.
This is something that will really uplift not just the cancer patients but also the families, di ba?
Talking about yung pag-usbong nung health and wellness apps, I was just looking at some statistics. During the pandemic, it really went through the roof. The number of health and wellness apps that you can download on a Google Play Store or an Apple App Store just went up. I've counted like 54,000. I mean, that's what the data says. Pero sa ngayon, ang sabi ng statista, lately, it's come down by 20%. Why do you think that is? That there are less health and wellness apps out there globally?
Maybe at the onset, there was really a need for it. So everybody's there on that same space, right? But it takes a lot of hard work, resources to actually keep a platform like what we have in mWell, because we can't stand still. We're always in the process of innovating, developing, and making our experience much better.
What made you sure that this wasn't a one-off, a pandemic creation that might have already used its value from beyond the pandemic?
No, mWell kasi is corollary and complementary to MPH, di ba? In the MP group, we provide core services to the Filipinos: water, power, toll roads, healthcare. So it's really part of the strategy to be able to provide the needs and the essential services to the Filipinos and the communities that we serve.
And you mentioned OFWs earlier. I just wanted to know what the pull there was, and also to convince the OFWs that it was okay to check with a doctor who was not within your worksite or jurisdiction. I mean, what is parang the business case to have a Filipino doctor check you out when they can, within their own work jurisdictions, visit a doctor?
Actually, the push did not come from us, it actually came from them.
From them, which region of the world?
Through the Department of Migrant Workers. So we met with Secretary Toots Ople when she was still here. I think she was very happy to see mWell, and then she signed up with us right away because from their end, they were saying that just being able to talk to Filipino doctors in the same language was already a big help to OFWs, because we've had experiences, because every time we go out abroad, we make it a point to visit a DMW office there. So when we went to Dubai at Arab Health early this year, we talked to some OFWs, and one was actually sharing her story where, she went there to sing because the export product of the Philippines are really our talent, diba? In terms of entertainment, etc. Because she was talking to a doctor which could not understand her probably, or she could not understand. She ended up doing an operation where, her voice got affected and now she can't sing. How very sad, diba? So now it gives them more comfort to be able to talk to Filipino doctors. And we also have doctors who, by the way, because our doctors come from different parts of the country, right? So they speak the dialects, Ilocano, Bisaya. So you can choose who you want to talk to.
So nakasaad na rin doon kung ano yung kanilang mga languages understood.
Dialects
That's
and
visible.
language,
The
yes,
dialects
yes.
are visible to the OFWs who might want to use the online consultations.
Yes.
In terms of communities here, how are you approaching reaching more communities? Are you aligning with local government units? What's the strategy to make sure that when you go to a certain part of this country, there's a lot that's helped immediately?
So we partner with LGUs right now because part of the Universal Health Care program is to make health and wellness available nga primary care. So that's what we're doing, and we've also partnered with the First Lady's initiative, Lab for All. So they carry us every time they go around in each province, and that's how we actually get to expand our services, not just in that particular area, but within the province or cities and municipalities that we are tapped to, provide our service in naman. In respect of other communities, we've also started engaging with schools and universities. So, for example, one university, we're partnering with them initially for mind health for the students, so they're able to assess already the mind health of their students before they jump off the buildings, diba? So it's more a proactive way of making sure that the students are okay, not just physically but also mentally. And the push really came from the parents naman. So, yeah, we're servicing everybody.
So revenues are coming in.
Yes.
Break even?
This year.
This year. Which,
more than just break even.
More than just
I mean,
break even.
for a startup to actually have a 2-year turnaround, that's something.
What do you think is making that happen quicker than any other app?
Because 1, we are more cost efficient. Number 2, we have a kick-ass team. 3, the offerings we have are affordable, and we feel that it's something that's being embraced by everybody. And we're very innovative and creative. So very exciting, diba? UAAP, we actually have a partnership with them na. So we will have specific watches catered to, say, all UAAP teams. So UP, Ateneo, LaSalle. So here, for example, for UP, the will be maroon, and then they will have their own logos with UAAP. It's so nice. So we're being creative about it so that everybody naman will not be burdened with being healthy. So that's why that's part of the uh, creativity to push for health and wellness, and maybe gamifying it.
So you can confirm that it will be revenue contributing to the next fiscal year for the whole MPIC group,
Yes.
mWell app.
Yes.
And it's come a little quicker than you had expected over a 2-year time period. What's expected over the next, say, 5 years? As you say, you always have to iterate and innovate. What's out there that would make mWell ahead
So we've
of the
also
needs?
had offers for the platform to be white labeled in other countries, no? But we want to focus on the Philippines first to perfect everything here. Kasi that's why we do things. It's really for the country.
It's also a challenge because we are in an archipelagic country and about maybe 31 million still have to be connected. So presumably the innovative solutions that you should have on mWell will have to already assume that these will go into far-flung areas or connect far-flung areas even without digital connectivity.
So we've thought about that, and the great thing about being in this group is we have a lot of assets that we can optimize. So for example, if you have a smartphone and you don't have a digital or an e-wallet yet, we actually have Bayad centers who will accept cash and will give you a health passcode so that you can use it with your phone. But for those who have no smartphones whatsoever, we've actually used our smart retail network. We have over 1 million nationwide. And so the manangs also, the manangs in their communities with the mom and pop stores, they're able to make money outside of just selling goods. They will also turn them or transform them into community clinics in a way. So the manangs will be able to use their smartphones so that their neighbors who have no smartphones will be able to talk to a doctor digitally, and then that e-prescription also can be delivered in the sari-sari store, and then the neighbor can just pick it up from there.
And on a bigger scale, you did make a mention that people's health determines a country's economic progress. Could you connect the dots for us, how that happens from a healthy me to a healthy economy?
Healthy people enable progressive in a healthy economy, right? And also healthy people also make the initiatives to conserve and preserve our biodiversity and therefore enable a healthy planet. So everything comes from healthy people, and it is our responsibility to take care of ourselves because we're also stewards of each other and stewards of God's creation.
As stewards of each other and your family, how do you keep them well and encourage them to do what you do? Possibly not standing all day.
No, actually,
What do
it's
you tell
good
the
because
kids?
we make like dancing a fun family activity, even
At
if it's
home.
just for 30 minutes, or even just walking the dog. Because my daughter now, she's 8 years old, she has an watch, an mWell watch. We also have a Prodigy watch, by the way, for kids. And I think a month ago when she had some fever, I actually had her wear a ring so that the yayas will not anymore write down her temperature, her oxygen saturation, which is very important, diba? So they're there 24/7. I'm able to monitor her health, which sort of helped out.
And the hubby, are you able to monitor? No,
Now
to give him
he's
a
more
nudge.
He's
He's wearing 3 rings
Yes,
as well.
just
with a wedding
one.
ring. Just one. And the watch as well.
Yes, yes.
Well, all the best, Chaye. Thank you so much for the sharing.
thank
and
you.
All the best for health and wellness all throughout. Appreciate the
We should
time.
all be healthy and well.
Yes, we should.
Yeah.
You can also check out the long conversation on YouTube, Spotify, Apple Podcasts, and Google Podcasts. And if you haven't done so, like or follow my social media pages. I'm Cathy Yang, and this is Thought Leaders.